This video will be covering the anatomy and pathologies, specific pathologies of the mouth, the oropharynx, and the throat. So as far as anatomy goes, again, we're not going to get too deep into this. Lips, cheeks, tongue, teeth, we have some glands. Function, pass food, we chew, we secrete saliva, we talk, right? We breathe. And then we have the three salivary glands of the mouth, the parotid, the submandibular, and the sublingual. So the parotid within the cheek, anterior to the ear, submandibular below the mandibles, and sublingual beneath the tongue. And all of these contribute to secreting saliva. So here is that parotid gland, parotid glands, this is an accessory, parotid glands beneath the mandible, submandibular, and then beneath the tongue, sublingual there. As far as teeth go, I will ask in class, but I assume you've covered treatment for teeth. In total, an adult will have 32 teeth in these patterns, okay? 16 top and bottom. Usually dentists will break this into quadrants, right? So we have 4, 4, 8, 16. So they'll break it into quadrants. And then the anatomy of the tooth, right? We have a very small part that actually sticks out and is visible. We have the nerves and the blood supply that come all the way up. And then where they attach, right? This is the joint, the gomphoses of the tooth where it attaches. So kind of a unique structure. Teeth are pretty interesting. Notice we have a ligament which keeps those in. Actually, my first day as an athletic trainer, I had one of my athletes knocked out their tooth. So anyway, just be prepared to what to do should a tooth fall out. As far as anatomy of the neck, neck anatomy is really interesting, and especially as we pass down the trachea and the esophagus. So the hyoid, thyroid cartilage, we have some cricoid cartilage. Anyway, there is a lot of anatomy that happens in the neck. I don't feel particularly that you need a huge dose of this, but I want you to appreciate that we do have a hyoid bone that's palpable. So it's actually right up underneath usually where your head is. So we have the hyoid bone there. And then we have several series of cartilage. So including thyroid cartilage, we have cricoid cartilage, so cricothyroid muscle, and then we have some cartilage, so cricoid cartilage, here's the thyroid cartilage, that make up the Adam's apple. We have muscles that attach to those, and these contribute to our voice box. Okay? So when we do examination of the mouth and throat, you're just going to look in, right? As far as the mouth, we're just going to look in. You'll look at the face, head, neck for symmetry, but then palpation of that hyoid bone right up underneath the neck. You might come down and palpate that Adam's apple above and below it. A lot of people will check their glands right underneath, those submandibular glands to see if they're swollen. So, and then lips, if they're blue or not, etc. There's a lot to look at here. As far as into the mouth, if you're checking teeth, a lot of times it's helpful if you have someone say, or if you're checking tonsils, you might have someone say, and that's helpful. So just a couple pathologies that the book gets into that I thought I'd cover here. So pharyngitis and tonsillitis. So just know that the back of this throat, I think most of us have experienced this, can inflame. It's painful. I can't stand strep throat. It's it's one of the worst things. So, those tonsils can inflame. Maybe just your throat can inflame. So inflammation of the pharynx or tonsils, sore throat. It could be bacterial or viral. Now, this figure here has the bacterial with the white spots and the viral without. Just know that, sometimes people get viral infections with the white spots, and sometimes people get bacterial infections without the white spots. So it can go both ways, but commonly bacterial infections will have those white spots and viral infections will not, but not always. Okay. So on this pharyngitis, tonsillitis referral, if you're having problems for greater than 5 days, me, there was a time in my life I was getting strep throat constantly, and if I noticed that I was developing those symptoms for strep throat, I just immediately went to start on antibiotics. Remember, mono could result in that sore throat. And if an athlete has mono, you need to be more worried about the spleen than their tonsils, because that spleen will enlarge. So treatment, 10-day course, of antibiotics. You can do things to try to help relieve the pain and pressure. Salt water, maybe a steroid, Tylenol, ibuprofen, things like that. Return to play, they just need to be ready to go. No fever. They need to be able to eat and drink. No problems with breathing, etc. 7 to 14 days is probably a little conservative, but there you go. Laryngitis, inflammation of the larynx, right? Inflammation of the larynx. It can occur with a variety of bacterial or viral infections. You guys know if you get a cold, a lot of times you lose your voice, right? So those vocal cords can become inflamed, or the muscles that attach to them can have some problems. So can also be caused by direct trauma to the throat, allergy, smoke, overuse. Okay. Signs and symptoms: a hoarse or a weak voice. Sometimes it'll deepen. Usually resolves pretty quick. I think most of us have experience with laryngitis. Only problematic in athletes if we notice this fever. Okay. And then what do we do if it goes on for a long time and there's no resolution? We refer. Okay. So we might try to increase fluids. We might try to increase humidity of a relative location. Avoid things that are causing the problem, and then hopefully they can return to play pretty quickly. So the book put a few of these in. I put the tables in. Maybe we'll talk more about these. Maybe we won't. But anyway, that finishes this video on anatomy and pathologies of the mouth.